Hello, I am David Peñarrocha from Ibin Dental Clinic, and today I'm going to talk to you about guided surgery for placing dental implants. I see three main indications of this tool, of this guided surgery. The first one would be completely edentulous patients, where we are going to place 6 or 8 implants. And if we want to have a very good aesthetics and a good maintenance of our implants, these implants must be in a correct three-dimensional position. Doing this freehand is possible, but it is more complicated. So in those cases where we want the best possible outcome, what we can do is that we can organize with our dental technician the final position of our teeth of the patient. We can find this doing pictures of the patient, a three-dimensional scan, and with this information we can decide the final dental position. With this ideal position of the teeth, we can then plan the position of the implants within the bone. So there will be a compromise between the bone and the final teeth of the patient. With this position of the implants, we design a guide, and this guide we can use it the day of the surgery to precisely prepare the implant bed and place the implant through these metal rings. The second indication of guided surgery would be when we are placing implants close to sensitive anatomical structures, for example, dental nerves. In this case that we are seeing, we want to place 2 implants in lower premolars, in an area where we have not too much bone, there's some bone atrophy, and at the same time between the 2 implants there is the emergence of the mental nerve. So it is very hard to doing it freehand to place the 2 implants within the bone in the correct position and without damaging the nerve. With guided surgery, we can plan the ideal position of the 2 implants in the computer in a relaxed way without having to stress the patient. And once we decide the perfect position, we prepare a guide, a plastic guide, with these metal rings. We can transfer the ideal position to the implant in a more simple and predictable way with this guided surgery. The third indication of guided surgery could be placing implants in the aesthetic area. In the aesthetic area, a small change of less than 1 millimeter in any direction, close to one of the teeth, or perhaps too much in a tilted position, could yield an anesthetic outcome. So in the anterior area, especially in the upper maxilla, having the exact position will allow us to obtain the best aesthetic outcome possible. So what we can do is again decide the position of our implant in the software beforehand, before treating the patient, and then we transfer this ideal position with a guide that will allow us to prepare the implant site through these metal rings, place the implant through the metal rings, and it's a lot more easy than doing it in the freehand to have the ideal position that will allow us to obtain a good aesthetics. Moreover, this guided surgery usually allows us to do more atraumatic surgeries, because often we can do them without doing an incision of the patient and without having to elevate a flap. So in summary, I see 3 main situations where guided surgery really helps us and our patients. One would be completely edentulous patients, where we have to place many implants, 6, 8 implants in the exact position to deliver the patient a prosthesis with the ideal teeth that our lab has decided together with us. The second would be placing implants close to sensitive anatomical structures, especially nerves. And the third one would be implants in the aesthetic area, where planning and guiding the position of the implant will allow us to obtain the maximum aesthetic outcome and also less traumatic surgeries.